Which of the following is a primary technique used for blood reservation in a cardiopulmonary bypass (CPB) circuit? A. Hemodilution. B. Autotransfusion. C. Leukoreduction. D. Plateletpheresis. Answer: A. Hemodilution. Explanation: Hemodilution involves diluting the patient's blood by adding crystalloid or colloid solutions to the CPB circuit, thereby reducing the need for donor blood transfusion. It effectively reserves the patient's own blood by decreasing blood viscosity and minimizing red cell loss during surgery. Acute normal volemic hemodilution (ANH) in CPB blood conservation involves: A. Removal of blood after starting cardiopulmonary bypass. B. Removal of blood before bypass and reinfusion after surgery. C. Removing and discarding patient's blood. D. Collecting only platelets during surgery. Answer: B. Removal of blood before bypass and reinfusion after surgery. Explanation: in ANH, blood is collected from the patient before heparinization and initiation of bypass. This blood, rich in red blood cells, platelets, and coagulation factors, is stored and reinfused after bypass to minimize blood loss and transfusion needs. During CPB, the use of cell-saver technology primarily aims to: A. Increase heparin levels. B. Remove plasma proteins. C. Collect and wash red blood cells for reinfusion. D. Preserve clotting factors. Answer: C. Collect and wash red blood cells for reinfusion. Explanation: cell savers collect shed blood during surgery, wash it to remove contaminants, like fat and debris, and concentrate red blood cells for reinfusion. It is a vital technique to reduce allogeneic blood transfusion needs. Which blood conservation strategy involves modifying the CPB circuit design to reduce blood exposure? A. Ultrafiltration. B. Miniaturized bypass circuits. C. Antifibrinolytic therapy. D. Tranexamic acid infusion. Answer: B. Miniaturized bypass circuits. Explanation: miniaturized or reduced volume CPB circuits decrease the priming volume, leading to less hemodilution and blood contact with artificial surfaces, thus preserving blood elements and reducing transfusion requirements. Retrograde autologous priming (RAP) in cardiopulmonary bypass refers to: A. Pumping donor blood into the patient before CPB. B. Using crystalloid solutions to prime the circuit. C. Replacing priming fluid with patient's blood before starting CPB. D. Draining blood from the patient into a reservoir during CPB. Answer: C. Replacing priming fluid with patient's blood before starting CPB. Explanation: RAP involves displacing the crystalloid prime in the CPB circuit with the patient's own blood before initiating bypass. This reduces the dilutional effect of priming fluids and helps conserve red blood cells and plasma proteins. Ultrafiltration during CPB mainly helps in: A. Increasing platelet count. B. Decreasing plasma-free hemoglobin. C. Removing excess water and inflammatory mediators. D. Increasing heparin concentration. Answer: C. Removing excess water and inflammatory mediators. Explanation: ultrafiltration concentrates blood by removing plasma water and low molecular weight solutes, including inflammatory mediators, during or after CPB, thereby improving hematocrit and reducing the risk of postoperative edema. Which of the following is not a blood reservation strategy during CPB? A. Retrograde autologous priming. B. Acute normal volemic hemodilution. C. Excessive crystalloid priming without replacement. D. Cell salvage and reinfusion. Answer: C. Excessive crystalloid priming without replacement. Explanation: excessive crystalloid priming causes significant hemodilution, leading to decreased hematocrit and increased need for transfusions. It is counterproductive for blood reservation during CPB. Which antifibrinolytic agent is commonly used during CPB to minimize bleeding and thus conserve blood? A. Protamine sulfate. B. Tranexamic acid. C. Heparin. D. Sodium citrate. Answer: B. Tranexamic acid. Explanation: tranexamic acid is an antifibrinolytic that inhibits plasminogen activation, stabilizing clots and reducing intraoperative and postoperative bleeding. This helps in conserving the patient's blood during and after CPB. Which method best prevents excessive dilution of coagulation factors during CPB? A. Using fresh frozen plasma as priming fluid. B. Performing controlled ultrafiltration. C. Increasing systemic heparin dose. D. Reducing mean arterial pressure. Answer: A. Using fresh frozen plasma as priming fluid. Explanation: using fresh frozen plasma, FFP, as part of the priming solution can supplement coagulation factors and proteins that otherwise get diluted during CPB, minimizing coagulopathy and conserving endogenous clotting ability. The main advantage of modified ultrafiltration, MUF, performed after CPB is: A. Decreasing systemic vascular resistance. B. Improving hematocrit and reducing edema. C. Increasing fluid overload for better perfusion. D. Enhancing heparin clearance. Answer: B. Improving hematocrit and reducing edema. Explanation: modified ultrafiltration, MUF, is performed immediately after CPB to remove excess water, increase hematocrit, and concentrate plasma proteins, improving postoperative outcomes, especially in pediatric and adult cardiac surgery.